Sorry, I wasn't taking roll call.
Okay.
Ben,
Yep. I think that's
Glenn? Oh, Glenn's not gonna make it.
no,
no,
Glenn's here.
Ben's here. Ben
I
Wilson,
see.
I think
I
is
was
the only
looking for
one.
the picture.
Yeah,
Face.
Ben is not here. Other than that, I think that's about it. So, all right. Good deal. So good morning, everyone. I asked for this meeting because there have been things that go on, as we know, in the world of COVID-19. And so one of the things, obviously, as you all know, we approved a fall plan. The board did at the end of June. So that is currently the plan for fall. One of the things that's been talked about at the state level over the summer and on the and it's with superintendents has been the idea of a mitigation plan. And so, having something on paper as an addendum to the fall plan. So it really is the nitty gritty of the fall plan. And so I asked Kathy to put together a PowerPoint about this. And what I'd like to do is have Kathy take us through that. And then we have some conversation about what recommendations we may need to make to the board on the mitigation plan, and if anything on the fall plan that we have. So I think it's important to remember that this group only recommends, it does not decide. The board is the final decider, but I think it's important that we have this conversation before it goes to the board, so the board can know where the stakeholders stand. So that being said, Kathy, do you have the ability to share your screen?
No.
All right, hold on. Let me fix that.
So while you're doing that, just so you know, the standard operating procedure so far has not been updated since May 13th. We were hoping for an updated one last week. So I know Andy and I have a couple of meetings with the commissioners this week. So I would be expecting, I was kind of hoping to have whatever we had before it went to the board, just to see if it would change any of the plan that we're reviewing today. But so that will be updated. We did meet, Jody and I did attend a webinar with Dr. Shaw and the CDC. It was advertised and it was recorded so other people could view it. And then there was frequently asked questions that were asked in the chat, and they did, for the most part, respond to those on August 2nd. So we did get our most updated questions from that webinar. We'd made our PowerPoint mitigation plan after meeting with Dr. Shaw. And let's see, and Ben just walked into my room, so we're all here now.
Okay.
Sorry, I was looking at things. Okay. And there we go. So last year, when we met in the summer, we had a bunch of committees that were going over all of the recommendations, and the DOE and the CDC had given us 6 requirements as part of our mitigation of last fall. This year, they have changed that to about 4 of things that they recommend, and there is 1 thing that they require. So I just wanted to be clear about what the messaging is from the CDC and the DOE at this point. So the first one is that they recommend universal masking in schools to help students and safe staff gather in person when there is a high variant in your county. So they will still continue to do county colors. In addition, number 2 is that on school provided transportation, masks are required. That is the only one right now that is a requirement per the US CDC order. So in the past, Maine has not always done the same requirements as the US CDC. Sometimes they weren't matching, but at this point, they're using the CDC from the US department. Number 3 is number 3 and 4, I think, is the one that they spent most of the time talking about. And they're really trying to push for vaccination and pool testing. So number 3 talks about vaccinations, and we'll talk about what are some of the things that we're required to do in the district level. And it's just a piece of vaccinations are helping reduce the spread of COVID. So anyone that is allowed to be vaccinated 12 and up, they're recommending that everyone get vaccinated to be in schools. And then they're recommending that we do screen testing, which is called pool testing. And we'll talk a little bit about that. So in terms of masking, right now it is only required if students are riding our buses or our vans. If they take private transportation, those that we are using contracted services have already been in contact with and understand that they will be required on transportation. We are suggesting today a different color code system will be determined when and where masks would be required. And then we can talk a little bit more about that. Again, vaccinations they're recommending anyone who's eligible to get it to ensure school safety. We will be working on pop-up clinics, sharing resources on our website, and we'll post our vaccination rates as required by DHHS each month. Pool testing, just wanted to remind you that this CPT team did review the procedures at the end of last school year, so last spring, and all the requirements that came about and what our capacity in RSU for to participate in pool testing. There has been a bunch of schools that have done it last spring as well as during summer school. They are averaging about 1% of students. So every 1 in 100 tests are coming out positive. And so that is not just in Maine, but it's also nationwide. So our percentages are about the same nationwide. At the time in spring, this team recommended to the board of directors that we do not participate in pool testing. Part of the pool testing reduced the amount of quarantine needed for those that were unvaccinated. And we just want to make sure that we review pool testing as it's one of the recommendations as part of the US CDC's mitigation plan. So today we're kind of asking us to use a color code system similar to the county one. We'll have a school color code system and as well as an individual one. Last year, we did have an individual plan that the nurses used when students or staff were sick. So we'll kind of talk about what does that look like when an individual is exhibiting symptoms. So our school level plan, it will look like green, yellow, and red, and we have some different pieces. So and I definitely want to hear from like Jody in terms of number of cases or things like that. All of this suggestions can be changed after we review everything. So a green school, so this would be school, not district level. So a green school that has had 0 or 1 positive case in a 10-day period would follow the green mitigation plan. If a school has 2 or 3, they would be following the yellow mitigation plan. And if a school has 4 or more, in a 10-day period, they'd be following the red mitigation plan. In terms of CDC, they consider it an outbreak if you have 3 or more. Last year, we only had 1 school that was close to getting into an outbreak status. But for the most part, most of our schools would have been, if we looked at last year, would have been in the green and the yellow categories. So while a school is designated a green school, we're suggesting that masks would not be required, as the CDC and the DOE has recommended that all unvaccinated individuals, including those 12 and under that are not eligible for a COVID vaccine, wear face coverings indoors. All the recommendations are regarding indoors. Outdoors, no masks are required. Masks are required even in a green school on any use of transportation, as that is the only requirement in part of the SOP plan. Physical distancing will continue to practice, especially in bigger learning environments, or we'll try to make sure that traffic flow, all of those things that we put in place last year will continue to reduce the social distancing or mitigate and make sure that kids are socially distanced as much as possible. We will continue hand hygiene and disinfection practices as a part of a place to stop the spread of the disease. If a student or if a school ends up moving to a yellow in the mitigation plan, regardless of vaccination status, we would be asking for masks to be required. So if we're starting to see our numbers in the school increase, everyone would be wearing masks. However, masks would still not be required outdoors. Physical distancing would be continued, and classrooms that there's been a close contact in a positive case can still attend school, but will be given a symptom checker, a temperature check, and potting where possible. So this can happen more in the pre-K 4 world, that classrooms would kind of stay within their own class and not kind of trade classes, because that's where most of our unvaccinated children are. So we would try to do a lot more potting. So they wouldn't necessarily go to lunch. They would have lunch as a classroom versus joining all the other classes during that week, then an identification of a positive case in that classroom. Again, hand hygiene and disinfectant practices will continue like we did last year. I think it's important, if we are red, that we let parents know that this could be an option, that there might be times where kids have to quarantine or staff have to quarantine, that students will be learning in a remote setting. So it's not saying that we're going to go there, but we need to make sure that parents are clear that this is also is an option, that we may not have a choice. Just like before, we would have our learning platforms updated, and so students can bring home their device and they can access their learning through their learning platforms, and in certain grade levels will be able to do synchronous learning. I just want to be clear that the red designation would only happen if we see an increase in COVID cases or a lack of staffing due to quarantines. And this would just be, for some, it might just be a grade level. We've had that happen a couple of times. It doesn't necessarily mean an entire school. Something we didn't talk about last year, but unlike pool testing where everyone has to get tested weekly, there is an option to do the Binax Now testing, rapid testing. The nurses did meet this summer and did explore the option to do rapid testing and are allowing us to bring this forward to CPT. This would help those students stay out of quarantine, help with keeping kids in school 5 days a week. So it would be students that are maybe feeling sick could get a Binax Now rapid test, wear a mask, and go back to school. Contact tracing, the difference from last year to this year is when we had a positive case in the classroom, we were actually putting all the students in the class in quarantine. If you remember last spring, the CDC changed the recommendation to only 6 feet around the child that was positive. At the time, we just felt like we wanted to keep the same standard operating procedure for last year, just for ease. We said we would revisit that. And we're suggesting that we go back to that recommendation of the 6-foot bubble. We say that because we know from our data and also through the data in Maine that kids that were put into quarantine did not become positive. So we know that if we reduce the amount of close contacts, it reduces how many kids have to be in quarantine. So this also means that our staff have to be really vigilant about their seating charts, as well as knowing where students are during the day. So we are suggesting that we just look at the 6-foot bubble of a positive case. And so that would be the school level in terms of our color coding system. Just like last year, we had individual SOP if students or staff were sick. What did that look like? They will be updating the symptom checker. So currently, we're still using the same one I think was updated don't quote me, but I think it was October 9th of 2020. So we haven't seen an updated one in quite some time. So there is supposed to be an update to that morning checker that we used to ask parents to complete and double check, as well as staff ask these questions. And if you can, answer no, then you can come to school. So an individual, if they're not exhibiting any symptoms, the individual can come to school and follow the school level designation. So I might not have any symptoms, but if I go to school in a yellow school, I'm still going to be wearing a mask. But if I am not wearing any, if I am vaccinated and I don't have any symptoms, I'm in a green school, mask is optional for me. So that's what we're kind of suggesting, that the individual needs to look at their symptoms, how they're feeling, what their vaccination status is, and then look at the school level to see what mitigation plan that they need to follow. If an individual is exhibiting any low-level symptom, they are welcome to continue to come to school, but they must wear a mask regardless of vaccination status. So that it's always a question. We're heading into the fall. There certainly will be allergies. There is a piece about, Dr. Shah talks about like confidence in what other people have. And we don't know if people are vaccinated or not vaccinated, but we really want to say if you're exhibiting any symptoms, you're wearing a mask to make people feel safe in their learning environment. And so we're asking any kind of symptoms, regardless of the diagnosis, if you're exhibiting symptoms, you wear a mask. If the individual develops worsening symptoms, then they would move to the red designation. And at that point, if the symptoms are either what they used to category low level, high level, if they're in the high level, they would be staying home. And then you would follow the instructions of how to come back to school, similar to what we had last year. So in green, you're feeling good, masks are not required. It's still recommended that unvaccinated individuals and 12 and under that are not vaccinated wear face coverings indoors, still have to wear them on school transportation, not required outdoors at all. And they should be completing the home screener prior to coming onto school grounds, similar to last year. Your low-level symptoms are headaches, congestion, running nose, nausea, vomiting, diarrhea, muscle aches, and pains. That would make that individual yellow. We're saying masks will be required if you are not feeling good, but we're still allowing you to come to school, which wasn't necessarily the case last year. They will contact the nurse for documentation so we know when or how long they would be wearing a mask for, but they can still attend school. And they would notify the nurse if other symptoms start or if the symptoms worsen. And red, these were the high level. Again, the CDC might update these in the next couple of weeks, but right now they are listed as cough, shortness of breath, new loss of taste or smell, sore throat, chills, and 100.4 fever. Anyone that's in red is asked to stay home, contact the nurse so we can document that, and we can make sure you can access remote learning through your learning platforms. And we suggest that you call your PCP regarding next steps. If you are in red, you would then follow these same measures. These are the exact same ones that when students were put into isolation room or called, these were the similar pieces that our nurses would walk our parents through. So if you got a diagnosis that it was an allergies, then they would kind of walk through that diagnosis side. If there was no diagnosis, then they would talk to the nurse and talk about you have to meet all these three criteria: 10 days, no fever for 24 hours, and an improvement of symptoms, and then they could come back. There are times when individuals go to see their PCP and are recommended to have a COVID test. If a COVID test at that point is taken, if it's a negative test, they need to make sure that they're still fever-free without the aid of medication. If it's a positive test, then they're using the CDC guidelines for a quarantine. The last two slides are the exact same procedures as last year, but we just wanted to be transparent with families through the color code system. If an individual is deemed a close contact, if they're vaccinated, they are not required to do a quarantine at this time, but it is recommended that they take a COVID test 3 to 5 days after the last day of exposure. They should be monitoring their symptoms for 10 days, but they can still attend school. If you're non-vaccinated, you would be required to, and you're within that 6-foot bubble of a positive case, you would be required to quarantine for 10 days. Again, recommended to take a COVID test 3 to 5 days after the last day of exposure. They can still attend school, but it would be done remotely from home. Traveling, we didn't do any, this always comes up, especially as we're looking at Labor Day. We always make sure that we follow the current guidelines from the CDC. Andy and I always put out a notification before every major break of the current guidelines, and we'll continue to do that because it changed, I think, 3 or 4 times through the last school year. Our dashboard on our website will look a little different this year. Instead of having it a date and the positive case of the close contacts, we'll actually be identifying each school will be listed with their color designation. So we'll keep that updated. So parents could always go through and say what color we are and what does that mean. They will actually see our staff vaccination percentage. So we are required monthly to fill out a report for DHHS on our percentage of staff vaccination. So we will have that vaccination that we're reporting to DHS that's on their dashboard will also be on our website as well. Each school will have their positive cases with their dates listed. We will not be posting how many close contacts because we're reducing the number. We don't want to make it identifiable of which students would be close contacts. And we'll also break down the cases in the district by month so we can kind of see compared to last year to this year if there's specific months that we're seeing increase of cases. Again, just like I just said, that we'll be having to do our first report September 1st and identifying what our percentage of vaccination stats are in RSU 4. So our plan for approval next steps is to discuss all of these pieces. I know there was a lot of information here at the CPT, and then these recommendations, I will change whatever this group decides, and then we'll be presenting the same plan to the board on August 11th to approve and vote. So that will be it for me. I am sure there's lots of questions and comments as we go through.
So I have some.
I would hope everyone does.
Well, yeah, I was gonna say, I would hope everybody does at some point.
All right, so I guess I was a little confused on the red slide. There was an asterisk at the bottom, but I didn't see one in the text anywhere to go and point you down to the bottom. So, and I think the note at the bottom was kind of important, like it was expanding on something that was mentioned above, and I'm not exactly sure what.
It's just expanding the whole, it's just letting them know that it has nothing to do with any specific in the slide. It's really about the whole slide, that it's really about, the red designation is really about an increase of COVID cases or lack of staffing, that there are times where we might put a grade level into red, not necessarily entire school. And that has to do with staffing, not necessarily COVID cases.
Right, so when we look at our color designations for the first slide where we had the green, yellow, and red, it spoke about 4 or more cases in a 10-day period.
Yeah.
Was right. And then your other red slide then talked about loss of staff or increasing cases. Is it increasing cases, or is it once the cases get to 4 or more in 10 days? They're a little bit in conflict with each other as far as when to go. Maybe the first one needs to go and include, I don't see how we're going to have so few close contacts as we did last year, when we're now going to have our classrooms full and we're going to allow students to be unmasked. The 6 foot, and I don't know of any class that I probably ever attended where I stayed one group of people. I had a 6 foot circle, and those are the only people that I associated during that class, except in a lecture hall. But then we got together and talked afterwards, or as we moved back and forth between the study hall and our next classes. So I was a little concerned about we're doing a lot of stuff based upon the numbers we had last year when all students and staff were masked all the time. And now we're not going to have a mask, and we're expecting to have the same low numbers of transmission. So I'm a little concerned about, from my perspective, of, I guess, of the ability that we're going to provide for the transmission of what is now being proven to be a variant of the COVID that is striking younger and younger people and making them sicker. I have a responsibility as a board member to provide for the safety of the students and staff, and I'm a little concerned, having buried a son at the age of 7. I don't want any other parent to have to go through what I went through during that time because of a child passing away. And that's after, when they were only a few months old, being stricken and almost passing away then. So there was a time period in between. So it's very painful, and I don't want to be held responsible by others. I would rather them go and throw darts at me because I'm overprotective of their children and of their children's friends than I would be to have them look at me and know that I could have provided a safer environment for their students, and so that they would not have come up, or for their staff member, so they would not have come up sick. So I must say, I am concerned, one, that we didn't do the pool testing. I think I spoke about that. We now have another chunk of money that could be used for any support that we would need to do that over the next 2 years, if it would take that long. And I guess the mask, we're going to have them wear a mask on the buses because that's required, but then take them off when they go into school, just because it's not required, but they're going to be in the same close proximity with a different set of students in most cases, because they're going to be intermingled and not by classrooms on the buses. So those are kind of mine. And I did have a question on the low-level symptoms. I guess it just kind of, and I know that this is some guidance that comes someplace else, what's low level, what's high level, but it's a symptom's a symptom. I guess you wait, if your temperature is 100.3, you're okay, but it's 100.4, you're out of school. I'm just, just things that I'm worried about from my perspective. I think, the slides were pretty informative, but we keep referring back to why we can do it this way, because we had such low numbers last year. Our close contacts were so low. We're taking away the protective measures that help that happen. We're taking away the pool groups, the small classrooms. We're taking away the masks. They're not required. So a lot of those things that may have kept our numbers low, we are removing. So those are my concerns on this, and I'll let these other committee members speak up with theirs.
I appreciate that, Bob. I just want to ask a clarifying question. So if I change it so it's not on the red slide about an increase, but about and I use the term number of cases, it would match. Is that clearer?
Yeah, I think I would think that either we have to tie together that it's possible that we're going to have to, I don't know how we're going to move to a hybrid. If we're short on staff or we have a lot of students, how are you going to split the class up into 2 pieces and send a couple one day? That's going to be a real monkey with a football scenario. It's either they're all remote, if that's what you have because you don't have a teacher, or they're all in class with some other option, whatever that might be. So I don't think that we can move overnight, because that's when you're going to know, right? I mean, you're going to get information one day that's going to be in effect tomorrow, and how you're going to move to a hybrid model, unless it's only the students you're quarantined
Yeah, I'm not suggesting us moving to a hybrid model. So I was charged with taking the current recommendations and making a plan of what could work for RSU 4. You mentioned pool testing. If this committee wants us to go back and explore pool testing, then we will see what our capacity is and report back. I just wanted to make sure everything was on the table and we revisited everything. So
I take that. I
think
take the hybrid out. I mean, the hybrid, as soon as people see hybrid, they're going, we're going to be splitting kids in half. They're going to be going twice a week. Our goal is to have them in school 5 days a week. That's why we want them. That's where we want them there safely 5 days a week in school. And if we have close contacts that have to be out of school, well, we're going to either have to find a way to instruct them. And I don't know, I want to call that hybrid, but they would be remote learning during their quarantine period and not necessarily hybrid. I think just the connotations of the hybrid term, everybody will think of last year.
Yep.
And that's not where we're going. I don't think we should have a plan to do that at all. Just to go into the year, if things get so bad that we're looking at hybrid, then that's going to be a really serious scenario we're in, and whether we're going to have kids in school at all, if it's affecting because of the students getting sick, that would be a different discussion we'll have to have at that time.
Thank you, Bob.
Heather raised her hand.
Yeah, I just had a couple things that stood out to me from that presentation. The first Bob also mentioned was the 6-foot bubble. I am a little concerned about how we would track that as a teacher, with 15 to 20 students in your classroom that are constantly moving. It seems like it would be a logistical hardship for teachers. Another question I had was when you mentioned that students would, if they go into the red, would go remote. I was wondering, I know that our middle school and our high school last year were able to get into a routine of students logging into the class and having the teacher be able to handle the two different categories of students. I was wondering what that would look like for our primary schools and Carrie Ricker, because we didn't get into that last year. And then the other thing I was wondering was, when you talked about the individual guidelines, the color coding, was that for students or was that for students and staff?
Individuals is all. So if you're exhibiting, we had the same SOP in terms of symptoms based on the guidance. So it would be, if you're showing symptoms, you're following the same guidelines. Everyone had the same preschool screener. Everyone had the same SOP in terms of expectations when you had symptoms or quarantine. So individuals is individuals. It doesn't matter.
So, and one of the biggest pieces that stuck out to me with that was, again, in that red category, are we saying that if staff are out, they're going to be able to work remotely, every staff member? So similar to, I didn't go into the synchronous, asynchronous, that's not a CPT decision. That's a school level leadership team decision on how that would work. Certainly would, support with the A team in terms of whether the staff can work or not. That's not a CPT conversation. That's an administrative conversation, probably with the association, but certainly not a CPT question. So, or one that I feel like that they could recommend to the board. That's not kind of something we still need to kind of explore and discuss, but I don't think it's necessarily for this team. Maybe Andy.
I would say, Heather, that we would of course, we haven't looked at that yet, but we probably take that on a case-by-case basis. There are some things that can be done from home. There are some things that can't, depending on job function, would depend on who could work from home and who couldn't. But certainly, as we did last year, that'll be a conversation that we have for sure.
So those were the three things that stuck out to me.
Will has his hand raised.
First of all, Kathy, thank you. Good job. I mean, it's clear what the intentions are. I echo a little bit about what Bob said, and I can't remember the context of the slide. So I agree that reference to hybrid, unless it's absolutely necessary, and these probably should be taken out. And maybe it's just remote in that case. And if it turns out to be hybrid, whatever. I'm not a big fan of agreeing with Bob on so many things all at once, but I don't know if we can do that. I shared, Andy and Kathy, a link to a story from the Hill about those with the Delta variant, what the symptoms are, and it's a much more lower level of threshold than it was a year ago, what we thought COVID was. So I don't know, I almost feel like the threshold for further testing in terms of symptoms, maybe we should realign those a little. I don't know, we'll see. This is just one opinion, one story about that, right? If you go by this article, you know, if you have a runny nose, you should probably get tested for COVID and so on. And so it's complicated. I think people, I don't know if the nursing staff and others maybe should weigh in a little bit on that piece. Like just share it for conversation and for whatever.
I think, Will, what we've done is we stick with whatever the guidance is at the DOE. When they update it, then we'll update it. And then usually we meet as a CPT and discuss what those updates are. I know from the FAQ from our Dr. Shaw meeting that it will get updated. It's supposed to get updated before our school starts. I know there was a push because like the counties, schools are already starting ahead of us. So we'll kind of see what will happen before our September 1st start.
Thank you. And reference the 6-foot bubble in the classroom. Are we not applying the 6-foot bubble to the school bus because we're masked on the school buses? Is that why we're not really, just curious about that? Another, not commenting if it's right or wrong, but just too hard to do, and that's fine, but.
So the ventilation is different because it's still kind of considered in that outdoor range because they have the windows open. Even in the winter, there was still percentage of windows open at the beginning of the bus and the end. So they've been categorizing the bus with masks as in like an outdoor space.
Okay.
Yeah.
Good. I think that was, what about, do you know what Lewiston has planned to do with regards to LRTC? Do these kind of align?
So all our local area districts are not requiring universal masking. They're all doing following this similar plan, not necessarily color coding by schools or anything. Some have different matrices or whatever, but all our local areas are just doing, if you're vaccinated, it's optional, and following the recommendation of just on the bus. And if you're unvaccinated, to be wearing masks. So Lewiston, I'm not sure about Auburn. I cannot verify. They are going to the board, I believe this Wednesday, but they hadn't finalized their plan. But Lisbon, 5216, all of them are in the following the CDC guidelines at this point.
I ask in part because as an LRTC family, do I need to follow guidelines from both schools if they're different? If Maddox has one in his class at LRTC or so on and so forth, I assume the two schools will talk about if he was in a class or within a cohort. I know there's only, I think, 6 in his class anyway. So hopefully, fingers crossed, but we know what happened last year.
And we had some issues with that last year, didn't we? Just about application of things. But one of the things that we're doing now, a couple of things, there's going to be a weekly meeting on Mondays with the commissioner and the deputy commissioner for superintendents. Then on Wednesdays, we will meet regularly with the area superintendents. So that's where we have those conversations for sure. So,
and I guess one, yeah.
Oh, and I shared our frustration with last year over some of the things that happened between LRTC, our students at LRTC, and the communication gaps and things like that. And he assured me that things would get tidied up a little better. So,
But I guess if you're, I mean, Will, you bring up a really great point. But there might be times where your child goes to LRTC and it's optional, but Oak Hill High School is in the yellow, which means he's required to wear a mask. You know, if he was vaccinated, it might be optional at LRTC, but when he returns for his fourth period, he has to wear a mask. So things may not always align. It's really about what his learning environment looks like and the level of exposure. So we'll continue to communicate that with our students and families.
And I guess one last comment, I share again Bob's concerns with the youngest students in our communities. It's beyond. I'm glad mine are older and vaccinated and so on. So I hope that I definitely share some of Bob's sentiments. And just another, and this is way in the weeds, and I apologize for this group, but and we bring it up to to the athletic director and so on. One thing I would like to see this year is the ability of student athletes to not have to take the bus from away games. As a family, we are trying to bring the boys to and from school whenever possible. So it would be nice if we could see, make sure the coaches have the leeway from the administration to say the kids don't have to take the bus to games or away games. I know that might bring into other things, but if there's a way we can have that conversation, that would be great.
sure.
And the
Thank you.
MPA is going to be giving guidance next on the 18th, I think, more about what fall will look like. So we really, if you notice, we did avoid athletics and because we're really not sure what that will look like. And I do want to remind you, we did have summer school. We had 3 sessions. Actually, this is our last week of our summer school session for our third one. The first session, we were fully masked. The last 2 sessions, it was optional, almost following this plan. About 24 hours before the summer school session number 2 started came the busing piece. And so students have been wearing masks on the bus and being optional for parents. I will say about 95% of our students, maybe Jamie, you can maybe give me a better percentage, but when it's not a set time, just looking at our little friends that have been doing summer school in the pre-K-5 world, about 95% are not wearing masks, just so you can understand the parent choice there. And we have not had, knock on wood, a case of COVID during our summer school. So I think that's important just to kind of understand our parents and our communities exposure or choice during summer school. So,
Thank you.
Jeremy? Oh, unless Will's not done, sorry.
Good, thank you.
Okay.
So I had, I think 2 items. The first is the yellow for individuals, which I know others have mentioned as well. But the yellow designation, it does kind of tells us or tells parents to send their kids if they're and have diarrhea, which we don't usually like to have kids come to school. So might want to think about having some of those either disappear or move to the red. I know it's following the CDC guidance currently, but we usually don't want those kids in the school. We've had to send at least 1 student home, not necessarily for that reason, but 1 student home from summer school had to be picked up for being sick. And so I hate to see us give parents the wrong impression of send your kids to school when they're sick. Oh, they're only a little sick, it's fine. So I really, for me, a green and red would be great. I don't think we need yellow. I think that's too much at times for parents making judgment calls. Then oftentimes I've seen them err on the wrong side. And then second, how do we plan to communicate that a school goes from green to yellow or yellow to red?
So similar to how we had communication about every positive case, we would be sending out notification that that the school is in a different color designation. We would have it updated daily on the website, so parents could easily see that. And then you'll have not only the color code of the school, but you'll have the date, so you can kind of see what the 10-day period would be.
And then what would be the plan? Let's say 3 schools go yellow and nobody decides to send their kids for a day.
As far as nobody sends their kids to school.
Well, I'm just thinking, for instance, my daughter's 10, and if her school was to go yellow, we might keep her home for the day, as
Sure.
many other parents might as well. Do you have an educational plan for those students at that time? And what happens if our attendance is very, very minimal for a day? What are the ideas there for having half the kids in school if they, out of the blue, don't show up?
Yeah, so we're still waiting our guidance on what attendance will look like or requirements from the DOE. So that usually determines on how we'll do that. I think that kind of goes back to Heather's question about synchronous or asynchronous, and that's for in the past, if we were all in person and you chose to keep your kid home, that child is not attending school and would need to make up the work as they would before. We do have the beauty of technology that allows kids to continue to access learning, so they don't get further behind. So we do have options. I think that will be a leadership team at the different buildings, because that will look different at Libby Tozier being a pre-KK building than it will at Carrie Ricker being a 3-4 building than it will at the middle school. So I don't necessarily want to say, well, this is how it's going to look. I think it really depends on the grade level. And I do think that our teachers are really smart and really creative, as they have been for the last year and a half, about how to make sure kids can do that. And I think, Nancy will chime in and say there are still kids who can't access it when we're remote. So we have to come up with, a plan D for some of those other kids as well. I hear you about the diarrhea and the symptoms and things. I think in our world, we were thinking, as the nurses have put on the table the rapid testing. If it's more about, if you're in school, all of a sudden you're exhibiting those symptoms, they come to the office, could they get a rapid test and know if they can continue to stay back? Diarrhea is one of those that, like, usually that's a don't pass, go straight home. But there are other symptoms on there. So we will be updating these. I definitely want to kind of follow those, but it was more about, I felt good in the morning, but then all of a sudden in the afternoon, I'm not feeling so hot. So what does that mean?
The way that the slide seems to be colored, I could see it telling parents, send them, they're fine.
Yeah.
Yeah. So I think probably we can take a look at that and make it a little more clear, because you're right, Jeremy. If my kids have diarrhea, they're not going to school. If they're vomiting, they're not going to school. So, that what we don't want to do. I mean, we know as educators, we have had, those of us that have worked in education, we have had parents who send kids to school sick, and that happens, unfortunately. And so we have to deal with those on a case-by-case basis. But overall, I agree with you. We don't want anybody getting the impression that I can be vomiting in the morning and still come to school. So I agree with you on that for sure. Anybody else have questions? Okay. So I took some notes on those questions about some things I think we need to talk about individually from this plan. So the first, what's come up a couple of times is the way we're doing contact tracing. Okay. And so we need to have last spring, I think, when we last talked about contact tracing, we kept the status quo of the way we were doing it before. So my question to the group is, do we want to continue to do it that way, or do we want to move to the 6-foot bubble the way the CDC says that we can do it? That's the first item.
I think it's really important that you understand that it could literally be 2 or 3 kids versus 90 kids, in a particular. So when you're looking at this, I think it's really important to understand how many kids would be put into quarantine. And this would be unvaccinated students, right? So if you're vaccinated, you kind of get a pass at this point. So I just wanted you to understand that it really could be a 2 to a 90 difference. The other piece you need to understand is we have reports all of Maine that there's been no positive case from another positive case in school. And so I think that's why we were moving to the 6 foot, because that abundance of caution verbiage, you know, and we just wanted to keep the SOP. But I just wanted you to understand the stats and what that number really looks like for RSU 4.
Ben?
I'd like to weigh in on that and just say that I think it's important that we move to what's being recommended in the 6 foot bubble. As you said, Kathy, the disruption to the educational environment when we do have a student who tests positive is substantial. And it sends students in the entirety of the class home when there does not seem to be the need to do so. So I personally, and as the administrator for Oak Hill High School, feel that the 6 foot bubble would be more than adequate.
All right, Ben?
I would agree with Marco that it would keep more students in the building. And, I know to go on Heather's comment about the complications with the primary school, we had some success with that last year as far as students staying where they need to stay in their realms of responsibility and with their peer groups, that it is possible. It is also more complicated, but it is possible. I do appreciate the 6 foot bubble.
Jeremy?
Certainly, if we're trying to get more in school and stay there, having an entire class go home if we're at capacity is a lot greater numbers. In a high school situation, you're looking at 4 periods in a day, up to what would that be? Let's say 80 kids.
Could be 80 kids.
More, perhaps if it's phys ed involved in the schedule. If it's 6 foot instead, the kids in a corner, which would be great rather than center of class, you're dealing with maybe 16 kids, right? So, the capacity and change there is huge. If kids are spaced in the classroom, do we know what space looks like in the classroom this year? Is it going to be similar to last year? I don't know that we have enough room to do that quite the same way. So you're probably going to have, it wouldn't be 16, then it'd be 24 kids, 28 kids, depending throughout the day.
So physical distancing was taken off as one of the CDC mitigation plans, similar to how cleaning and disinfecting, when they first thought COVID could be, spread through surfaces, we were doing different cleaning on times and things, even on playgrounds and such. So as we've learned and grown through this process, one of the things, and we specifically asked about physical distancing, and right now it's still the 3 foot, but even physical distancing was taken off as one of the mitigation strategies. And part of that was because they're trying to increase face-to-face learning for everyone.
So does that mean classrooms are still facing the same way? Are we still single desks, or can we do pods, or what does that look like as far as a classroom design?
So again, every classroom looks very different. If I look at like Sabatis, they're all very square. Where I go to Libby Tozier, and there's like pentagons and triangles and things. So it really has to do with your space of what you have available. I would work with administrators to kind of figure out how to maximize your space, but there's not necessarily requirements in terms of, similar to music. I think music was probably our most restrictive of like face forward, be like 16 feet away. All restrictions for music in UAs have been lifted at this time. And so there's not necessarily a restriction of how your classrooms need to be set up.
So the 6 foot rule or the 6 foot bubble. So in middle school, students typically stay in the same classroom all day and don't move around from classroom to classroom.
Middle school.
No,
moves.
they're similar to like,
Middle school, they're moving, but in like 5th and 6th grade,
no, they move. They have different teachers. So they have like a math teacher, a
so
science.
you have a 6-foot bubble on a student. So in first period, it's this group of students. In the next period, it's this group of students. In the next, so excuse me. I just don't see how we're going to be able to identify close contacts in a 6-foot bubble with students that are moving around from room to room without, I mean, you could in the high school, now that we do, you know, we only have what, 4 or 5 periods a day?
4.
Four.
And lunch. Yep.
So, and there's no requirements in lunch that they're going to maintain a bubble in lunch, right? They're going to sit with.
We actually didn't do close contacting tracing last year at lunch at all. It was just something that our capacity, but you need to understand, we're only identifying unvaccinated in that bubble. So where the students do the most movement is where there is the most vaccinated students. So
Okay.
where kids are mostly potted for the whole day is where our most unvaccinated or students are not eligible for vaccination.
And that's if we don't know the percentage of students in the high school that are actually vaccinated and who will say they are, but if you want proof, you're only going to get that if they're a close contact and they want that.
No, actually, Bob, we have, our nurses have access to the impact system. So our nurses actually can see every single student's vaccination record. It's actually a requirement of the law, under the law. And so we will actually know the percentage of students who have been vaccinated.
Okay.
Yeah.
And so then my other one is, I guess, and I mentioned this before, but Kathy, you mentioned it also in this discussion about whether it's going to be 6 kids or 90 kids, you know, students and staff members that might be close. 2 things. You went and mentioned that's based upon the results of last year where there was no in-school transmission. You have to remember, this plan is not the same plan that was in effect last year. Transmission is going to be a lot more easily performed or conducted if students aren't wearing masks. I mean, that's one reason why we didn't have it. I mean, that's what we told everybody. We didn't have the in-school transmissions because we were keeping social distancing, we were wearing masks, we had all this mitigation steps in place. We're removing those, and now we expect the same results. So let's don't try and justify this year's process based upon last year because it's an apples and oranges comparison on the situation that we're going to put the students in. Number 2 is that the case down in Massachusetts for the Delta that providing most all the research on it showed that the amount of the Delta virus that was in the noses, nasal passages of those who were vaccinated was just as high as those who was unvaccinated. There was we haven't been able to determine yet, according to as of yesterday information, whether or not someone who's vaccinated can actually transmit it or not. They could have the virus there, but not able to transmit it. I don't know how that works, but so, you know, I mean, this is a group discussion. I'm just letting myself, I find it's going to be tough to go and identify this close contacts within a 6-foot throughout the course of a day or a couple, 3 days. So it depends upon when they started showing symptoms and how long it keeps coming to school before they decided to let us know.
Well, and I would say, Bob, one of the things about, you know, not transmission, that's not us touting it. That's actually the CDC and DOE that's touting that everywhere. So, you know, at the end of the day, I don't disagree with you. You know, you put more students in a building, you unmask them, all those things. Their logical sense would say there is a higher probability of transmission in your building than not. But, you know, that's just the CDC and the DOE verbiage about, we haven't had a single case of transmission in our public schools.
That's not true, because I know that I have said that. I think it's been mentioned in school board meetings that we had people in there to go and keep the numbers down. And the reason why we weren't having any was because of the mitigation. So when we say maybe you didn't use those terms, but I think those terms were used in justifying what we were doing and
Mhm.
using the results that we had as further having been the right decision that was paid, even though it wasn't really in our hands to do it differently. That, and by going along with it, brings us right into the same pool and the same justification of the results. We will see. Hopefully, nobody gets sick. No one becomes a long hauler. No student suffers great lung damage and suffers the rest of their life, or staff member. So hopefully it will work out. If it doesn't, I guess those who make the decisions not to mask or not to have their students mask, we'll see what happens. That's all.
Jeremy
Right.
still had his hand up.
And Heather, you had your hand up
Sorry,
a
no.
while ago.
Yeah, I did. I kind of was going back and forth on a thought, and I wasn't sure, but I guess I'll just kind of reiterate maybe what I've already said. And it kind of goes along with what Bob is talking about. I guess just in thinking, it just kind of feels like, there is a big difference between, our population of students that are able to be vaccinated versus our students that aren't, the middle school and the high school versus the primary and elementary schools. I guess it is just a little worrisome that, we have more kids in our classrooms now than we did last year. We have a majority, our younger students won't be vaccinated and they won't be wearing masks. And there's less restrictions, if any, in our classrooms, really, with kids being close to one another, not facing the same facing different directions. I am still a little concerned about the 6 foot bubble piece in the younger grades. But that's just where I'm at.
Marco?
May I jump in?
Yeah, that was going to you, Marco.
All right, thanks. So, kind of building off of Bob, what you've mentioned, and, Heather, what you just said, my feeling is that, we're, kind of removing, some of the, as you said, Bob, some of the safeguards that we had in place last year that made the year, as successful as possible, given everything that we were going through. Again, this is my opinion. I feel like we need to keep some of those pieces in place. And, the one for me that makes the most sense, because, of a number of different factors, is to continue to have everybody masked, regardless of vaccination status. And I say that because, again, we're removing social distancing piece to a certain extent. We're having more kids in the building. We're already wearing them on the bus. It just makes it, I don't know if easier is the word I'm looking for, but universal in the sense that we're all doing, our part to ensure that we can continue to be in school 5 days a week with all of the kids in the building. And, we're, moving forward with, the year that's ahead of us. That's something that I feel like it would be, again, this is just my opinion, right? The easiest thing. I know that there are others that don't feel that way out there, but in regards to wearing a mask, but it would be the easiest thing and the best way to prevent any cases or hopefully any other variants that may come about.
So I want to get to masks, but I want to continue the conversation on contact tracing. So I don't want to step into masks until we've finished that. So Will, do we want to keep, I think we need to continue the conversation. Let's finish contact tracing, where this group stands on the 6 foot distance, the 6 foot bubble versus doing it the way we did last year. So I'd like to hear from every single person on that so this group can come up with a decision to make a recommendation to the board. So Jeremy?
Oh, Will, it's Will.
Oh,
first.
Will, sorry. Yep.
All right. I guess I have a quick question. This is direct to Bob. He's made a lot of really strong points. So Bob, what do you want? I haven't heard that yet. You said that you don't necessarily like the 6 foot bubble idea, and I'm with you, but I don't know what else is for you.
All right, if I may. So my problem with the 6 foot bubble is I didn't think that the staff members would be able to go and to come up with that solid 6 foot bubble for each of the classrooms for the student throughout their entire day. So,
Okay.
so I think it's an impractical requirement to go and enforce to identify those students. If I had the same students in the classroom all day long and they were at their own tables and they stayed around, then that's an easy thing to go and do. But, you know, all it takes is one sneeze out in the hallway and your 6 foot bubble is now 120 feet, you know? So that was my feel there. So I'm not sure in contract tracing what the thing is, if we're not doing it, you know, if we're not doing pool testing, which helps us identify before outbreaks happen, or if maybe we take everybody that was in there and do rapid tests on them, or whatever, but that's like 3 to 5 days after last contact, you know? So that doesn't work real well right away. So that was it. I guess my best mitigation theory that do this is the masking, universal masking, because each teacher probably does not have the right to know who's vaccinated and who's not. So who needs to wear a mask and who doesn't, if it's optional. Where it's universal, everybody wears it unless they have a reason, a justifiable reason not to, based upon medical needs. I know it's unpopular. I've been unpopular most of my life. So, you know, it came with my job in the Navy. But, you know, that's kind of, you know, that's, to me, that's the best mitigation that we can provide is masking. If we're not going to keep the social distance at 3 foot, we're going to let them intermingle, then the mask. My dog's going to go crazy, so I'm going to mute myself here. My daughter just got home.
Okay, Jeremy.
Yeah, I guess I was wondering, after a universal approach to, you know, the high school population is different. What classes they're going to be in desks most of the day.
Jeremy, I'm having a really hard time.
Keep breaking up.
Yeah, so can you take your video off and try that again?
Depending on the activity, younger grades can do. Any better?
Try again.
Yeah, we lost all of it.
No, any better? No.
Yeah,
Yes.
better.
All right. You can blame the high school. So my question was, do we need to have a universal response to contact tracing rather, considering that classes are engaged in different kinds of activities, so are different grade levels. As an English classroom, my students are generally in desks, seated. Contact tracing in my case is pretty simple, but may not be so simple in a phys ed class, for instance, or if you're doing a lab in a science class. But also, as you go down the grade levels, it's also going to be tougher, perhaps as well, if they're sharing materials or doing some groups of activities. I guess I wonder if context can be part of this as well, or just have a big universal, always 6 feet. I know one's easier.
Yep.
But I just wonder if there's might be some nuance to how we do this.
I think that,
you bring up a good point. It's kind of what I was thinking as everyone was talking is ultimately we need like what is the lowest bar. So if you're allowing us to follow the 6-foot rule and a teacher can come and say, yes, our activities were the kids were spaced out and they were sitting in their class the whole time, as opposed to a science lab and they were moving around, the teacher would just say, then everyone's a close contact. We work with every single teacher to determine using the seating charts, using the vaccination status to identify the close contact. So we did that regardless of, we had to check attendance and vaccination. Like there are multiple steps that we do before I identify a student with close contacts. But if there's an ability to then just do the 6-foot rule, I guess we're asking for the CPT team to allow us to do that. If a teacher says, no, my activities allow kids to mingle and they were all over the place, then we would put that whole classroom into close contact. So we're not saying that it's all or nothing. I mean, every case, I think, and Jody and I would go through every single case together because every case is different. But we're saying, are you allowing us at least this time, if we can just do a 6-foot bubble and get down to 2 kids versus the 90, are you as a CPT allowing us to have that recommendation to move forward? I guess.
Jody?
I was just going to make some of the same points that Kathy just did, that you know, while we were quarantining whole classrooms, once the recommendation for 6-foot came about, we started looking at it differently. Yes, we quarantined the whole classroom, but I know when I was quarantining students, I was also looking at, could I make that 6-foot distinction in those classrooms and comparing how many kids I actually put out to how many kids we could have kept in, just to see how that was going to work. If we did change to the 6-foot, even though we decided not to. So we were already doing a lot of that, and there's a lot of conversation that goes on and a lot of things that get checked and happen kind of behind the scenes when we're contact tracing. So I was just gonna make some of the same points that Kathy just made. As far as masking, I think because what Kathy's presented is a tiered system, if we get to the point where we're seeing transmission in the school or we're seeing increased cases, we're going to put the school into universal masking anyway. So if we can start out without masking and giving parents the option for their children to wear a mask or not wear a mask, depending on how their family feels about it, that may be easier for some people to send their kids back to school. And kind of the concerns that everybody's bringing up about if we're seeing, you know, that there'll be more transmission, that it's going to put us into masking anyway, based on the way the system is tiered. And so I just wanted to weigh in on that, I guess.
All right, let's just take a poll on contact tracing. It's really 2 options. Do we move to the ability to use the 6-foot bubble if we can, or do we continue what we did last year? So I'll start with Jody. Where are you at?
6 feet.
6 feet. Jeremy, where are you at?
With the info from Kathy and Jody, 6 feet's fine.
Okay, Will?
I agree. That last bit of information and that flexibility was important.
Yep. Marco?
6 feet.
Okay, Kathy?
6 feet.
Sherry?
6 feet.
Bob?
6 feet. Thank you for the additional information.
Nancy?
6 feet.
Okay, Lexi? Can't hear you.
I'm good with the 6 feet.
Okay, awesome. Heather?
Yeah, I get with that additional piece, the 6 feet.
Okay, Jamie?
I'm good with Kathy's clarification for 6 feet. Yep.
Okay, Ben?
6 feet.
Okay, Norma Jean?
6 feet.
Brandy?
Yes, 6 feet.
Okay, Glenn?
Yep, 6 feet.
Awesome. And I also fall in that category as well. I appreciate both Kathy and Jody for that extra bit of information. I mean, the reality is, what's that?
Maybe lead with that.
Yeah, I think that, yeah. I mean, at the end of the day, you know, they're the ones, they and the administrators are the ones and the teachers that are doing it are in the weeds with this. So it's really important that we hear from them. Okay, next thing we should discuss is pool testing. We had made the recommendation that we not pool test last year. Are we still there or not? So discussion first, then we'll open it up for a kind of a vote. Anybody want to talk about pool testing? Norma Jean?
I just had a quick question about the pool testing. Does that make a difference on what we decide for masks?
No, it really has to do with, well, yes and no. So it really has to do with quarantining. So for folks that are unvaccinated, it does not require those individuals to quarantine. But it would, in the real theory is that if you have high percentage participation rate, you would be then identifying students or staff that are positive. So you would be removing the positive case quicker. So you would reduce the spread, which means in our color code system, you would be closer to the green, right? It's a preventative piece. But the benefit is certainly, now we've gone through lots of trainings. Pool testing is really super effective when you're about 75% of your building doing pool testing, but your minimum is you need 30% of participation rate in each building in order for folks to not have to quarantine. And that percentage, or that denominator to get to that percent, to that 30%, includes vaccinated and non-vaccinated. So we do have to kind of think about whether we want to do it. The other conversation, if you remember from the spring, is that it doesn't have to be the entire district. We can do certain schools. So for example, you have middle school, high school has a higher percentage of vaccinated individuals, where in our pre-K4 world, we have less, which means you might want to try pool testing in the younger ones, where you have less unvaccinated, which means then it can reduce the quarantine component when there is positive cases.
Right. Will.
So, and Kathy, you alluded to this a little bit. If we were to do pool testing, would those positive cases count towards the color code? So, okay. So if we do pool testing and it turns out a lot of students are in it, while we've taken them out of the mix from possibly sharing it, it might be more apt to put us into a red, causing some of those things to kick in because we're testing more than would otherwise be found out as being positive. Is that correct?
I mean, ultimately, you should be. I would think that you're just catching it quicker, so you're reducing the amount of spread. But in terms of the end result of how many positive cases you're going to have in the school, I wouldn't think, in theory, that wouldn't change. It's just more catching asymptomatic folks that are spreading it prior to.
Heather?
Can you just do a really brief and quick recap of what the process would look like for pool testing?
Sure. I'm gonna turn that over to Jody. I've read way too many things about it, so Jody is the expert. I am not.
So your pool is tested twice a week. There would be a setup where we would have to determine what the pool is going to be made of. It's a lower nasal swab, so the students line up, swab their lower nasal cavity, and then all of the swabs in that pool get put into a vial. The vial gets packaged up, sent off to the lab. The lab tests it. If it comes back that your pool is negative, then everybody in your pool was negative. If it comes back, if it's positive, every person in that pool then gets a rapid Binax Now test, which is, again, a lower nasal swab. So they come in the morning, we test everybody to see if we can determine who the positive person was in that pool. If we determine the positive person, they go home, they're out for their 10-day isolation, and everybody goes back to class. If we don't determine a positive in that first round of testing, they all come back in the next day and we test them again to try and isolate the positive case. If we don't isolate a positive case in a pool, then everybody goes back to class and they get pool tested again. And you'd skip a day and then they do their pool testing that next scheduled pool testing day. and it starts again.
The
And-
size of your pool is related to the color of your county. So if your county color is in yellow, your pool testing gets smaller to like 5 to 10 versus a whole classroom of 25. So we're trying to narrow the pool of how many kids need to get retested.
And
We
who is
also-
doing the testing again?
So every school would have a 3-person team that would, there's a lot of behind the scene things that happen. So you have like kind of a testing coordinator. Now I have to look at the terms, but there's a testing coordinator that makes sure they log in all the information prior to, and then you have a test administrator that goes into the, brings all the vials in and all the swabs. Usually there's a test observer, which is the classroom teacher, that they're just making sure the flow of the classroom kind of goes. They don't touch anything, they don't do anything, they just kind of watch, make sure kids are doing it the correct way. And so then there's a person, usually the test coordinator gets all the results and then starts doing the barcoding. And then you have to mail them out that same day. So there's usually 3 people to coordinate per building to get that done.
And were we going to be bringing in people to do this, or was this going to be an added responsibility of staff members that are already there?
So if we, well, I can speak to this. If we determine that we're going to do this, I'm going to have to bring people in to do this. Our nurses have enough to do already. And so, they would end up probably doing some of the test coordinator pieces, but ultimately, they've got enough to do, our teachers have enough to do, our ed techs, everybody. And so I would be bringing in additional staff using the COVID relief funds to do that.
And part of the program is when you do the application for pool testing and asks you if you need help, it does limit your flexibility of which day you get support. Right, because they're helping a lot of different districts, but so you have a little bit more less flexibility of day, but you will get more support to get it done if the district so chooses. And it's all free costs, so it's not costing the district anything to pool test, except for time.
Sorry. Jeremy?
Just a question, how would LRTC attendance complicate this for students?
Well, I mean, it would depend if they're, I don't know. I don't have
I guess I worry that if a kid is tested on one day and needs to be retested, but goes to on the LRTC bus or drives themselves, they may be at LRTC for half a day before they come back to the school.
They'd have to come to us first. The day they were testing, they'd have to come to us first. There would be no choice. And the reality is that, and just another piece of this is, we can't just pool test people or pick who we test. We actually have to get permission from each person to be able to determine the pool. So, for instance, if I've got a class of 25 and we have to get permission from each kid's legal guardian before they can ever be tested. But in my mind, and Jody may say something different, so I'm going to look to her. But in my mind, if LRTC, if a student was being pool tested from LRTC, they'd need to come to us first. Is that accurate, Jody?
Yeah, they would have to be there for the pool day. If someone were to miss their pool testing day for that round of pool testing, it would be as if they were not opted into the program. So if they were identified as a close contact and the goal of the pool testing was to eliminate their quarantine requirement, if they missed their pool testing, they would have to quarantine during that round, but then could be tested during the next round and then would be back opted into the program.
Also going to think about too, we're on a red and white schedule, and the tests the first test is a PCR test, which takes time. So you're most likely going to be back to, if you were at LRTC on red, you might actually get the results on a white day, not the next, you know what I mean? It would be off. So the day that we would need to rapid test, the child might actually be back at Oak Hill when they got the regular test. So they might be only rapid tested on white days and LRTC red days, and that's where the testing will happen. So it's not immediate. It's a PCR test for that first one. The redo one is a rapid. So
I think it's just, there's time in between. We have to box stuff. UPS, it's kind of like Amazon Prime. It is not quite Prime anymore. So that does take a little bit of time to process.
Anybody else questions about pool testing? All right, so we need to do the same process here with pool testing for our recommendation. So I will start. Jeremy, where are you with pool testing?
Unsure, I suppose. I guess I had one more question. If we had a class of 20 kids, do you know how long it would take to test the kids in class?
They say it takes less than 10 minutes per class. Obviously, the first couple of times it takes a little longer because kids aren't used to the process. Based on their research or what they know of in the United States since they've been doing it in last spring, the results of like the younger ones, there's always question of like how much support do they need. The results of the students doing their own is actually been better than when there's been hand over hand to help. So a lot of times when parents go get a rapid test, they might help their own child. They're actually seeing better results when the child does it themselves. So it takes about 10-15 minutes. It takes a little longer at the very beginning because we're all learning our jobs and roles in the process, but it gets down to 10 minutes.
And then I guess one other question, do we have a sense of how many of our parents might opt kids in for this kind of thing? I mean, obviously it's brand new, but do we have any idea based on similar, there's nothing similar before, I know, but do parents generally opt into this kind of stuff for their children in our district?
We don't, when we made the decision to recommend not pool testing, we didn't survey the community. I would have to do that now. I know, and Jody, you're on the nurse listserv. What are we seeing in other districts for percentages?
The districts that have opted in are seeing anywhere from 30 to 45% opting in. But most of the chatter on there for the districts that have gotten really good opt-in are for boarding schools where they're requiring it. So I think it depends on the demographics of your population. And, without knowing if we would get to 30%, I think it would be hard to recommend that we opt into that because it's a whole lot of work without any benefit if we don't get to 30%.
Okay. Yeah, and knowing our communities, I'd hazard to guess we'd be on the lower end of that, but maybe I'm wrong. Will?
If this group said, yes, let's move forward, and then the board were to do the same, and there isn't the community support for doing it, is there a loss anywhere along this line other than time and effort on the front end to get it set up? What if we don't meet thresholds for the testing? I'm trying to get a feel for that balance of, I agree, I don't think we're going to get there. I'd be surprised if we get to 20 to 30%. And my fear is, not fear, those that may opt to participate already have their children vaccinated. So I wonder what the net positive is going to be if the people who aren't undertaking in this are those that are hesitant across the board for whatever reason that is. So I'm trying to figure out what if we say yes, the board says yes, what does that mean if we don't get community buy-in?
Kathy, Jody?
So I think it's time and effort, as you alluded to. If we don't hit the 30%, it's not worth the effort to continue in our classroom with the disruption of time and things like that. So I would say if this team and the board recommends we explore it, we will certainly explore it. But it would just be loss of time. It wouldn't be loss of money or a staff or what have you. So it would just be time and effort if it doesn't pan out.
And if we were to see increased community exposure and so on, let's say we say yes, go forward. The board says, yeah, they want to pursue it. We don't have community buy-in at the beginning, but come October, November, December, and there's increased community spread? Is it something that can be revisited without a lot of hardship? Asking the community again, is this a time? You've seen it.
Yep, it can, but there, you got to understand that there is a set onboard time. It takes like about 6 weeks to, by the time you do your application, work with the, the companies to input all of the data that needs to be added, and link all your systems together, and then train the individuals. At the time last spring and in the summer, at the very beginning, when they were onboarding a lot of the districts, they had a lot more trainings. Now, if you start getting into October, November, December, when most of the districts have decided one way or the other, we're then having to wait to whenever those trainings happen. Where right now they're kind of happening more regularly. So I don't know what the onboard timeline would be, but they would probably be a 4 to 6 week timeline from start to finish. So if it was a decision, it wouldn't be immediate implementation.
Okay. Anybody else? So I'm Bob.
Yeah, I think that initially I thought that it was a real possibility that if we did the pool testing, we'd be able to eliminate the mandatory mask. But that doesn't seem to be the case. So I don't know that the pool testing then, other than maybe preventing the spread to other students by early detection. So I'm not sure that there's a benefit that the community will realize until they get bit by doing pool testing or any of the other mitigation criteria that we're looking at. So I don't know.
Benefit is really for your unvaccinated, uneligible individuals to not have to quarantine if there is a positive case in their classroom. They would just continue to come to school, and we would take care of the testing for the family, and they would continue to come to school for face-to-face instruction. That would be the benefit. That's where the selling point is for your pre-K for your 12 and under students.
Right.
Not necessarily a major benefit, or harder sell for those that are 12 and up if they've already had eligibility of vaccination.
Right. So I would say that if this group wanted to even propose it to the board, that we would propose it just for the lower grades where their vaccination is not, they're not vaccine eligible. So that hopefully we could identify any cases that happen in our younger students sooner and to help protect them. But I don't see it as a district-wide option any longer at this point in the game.
Okay. So Bob's put an interesting thing on the table. Do we want to explore this district-wide, or do we want to look at it for K4? I will say, in my opinion, the nurses have said that they're willing to give the Binax testing, the rapid tests. I would argue we're going to get positive cases out of that far quicker than we ever are with pool testing. Jody, is that correct?
I don't know that.
No?
I think it would be even or equal. Our thoughts behind offering the Binax Now testing is basically, we sent a lot of kids home last year that in a normal year we wouldn't have sent home, and we were looking for the flexibility to be able to call the parent and say, Johnny has a sore throat. Typically I'd have to send him home and you would need to see your PCP, but I could offer a rapid test right now. If he tests negative, I can give him a cough drop in a water bottle and send him back to class. Is that something? And a mask. Right. And send him back to class. Is that something you'd be interested in? And, it's a hardship for a lot of our parents to, they've got to come pick up their student, and then they either have to get a doctor's appointment to take them in to be seen, or they have to get an appointment to take them for testing. And we were hoping to kind of eliminate some of that for parents and also keep kids in the classroom longer, because I know I sent a lot of kids home last year that in a normal year I would not have sent home. And this would be an option to kind of rule out, okay, it's not COVID, it's allergies, or it's whatever it is causing the sore throat or the runny nose or the cough or whatever. And then they could stay in school. So I think it probably would be about even what we would find positive tests with the rapid versus what we would find for positive tests for the pool testing.
Okay, no, then that clarifies it for me in my brain, because I thought about it differently. So thank you for that.
Yeah,
All
I
right.
think, think about it, it's like symptoms, if they really did the screener, if they're really sick, they would be staying home. So we're only going to get the 1% that's coming down to the office that's sick. And
Right.
for the rapid testing, where pool testing is like catching those that are that are either asymptomatic, or you're catching them before they get symptoms. So it's still a 1%, 1 out of 100 kids would test positive.
Okay. All right, thank you for that. Will, where do you stand? So we basically have a couple of different options. It's no district-wide, yes district-wide, or just pre-K 4.
I would lean towards pre-K 4, if at all.
Okay. All right, Kathy.
No for pool testing.
Okay. Sherry.
No for pool testing.
Okay. Marco.
No.
Okay. Bob.
I think that we ought to give that option to the board and just let the board know that it is an option out there, that we discussed it, the lower ones, and really have no real recommendation one way or the other, and just kind of leave it to the board to make the call on whether or not they want to do it.
Okay. Jody.
No for pool testing.
Nancy.
Nope.
Okay. Lexi. No. Okay. Heather.
No.
Okay. Jamie.
No, I like the Binax option much better, for sure, but no to pool testing.
Okay. Ben.
I'm with Jamie. I prefer the Binax option than pool testing.
Okay. Norma Jean.
No to pool testing.
Okay. Randy.
No to pool testing.
Okay. Jeremy.
I would say no currently.
Okay. Glenn.
Nope.
Okay. So I think what we'll do then, I mean, it's pretty unanimous for the most part in this group, that this group recommends no, although the board will have options. And I think that's the way we look at that. Would you agree, Bob? Yep. Okay. All right, good. Let's move on to the Binax test. We've already had some conversation about this. Any other conversation that we want to have with our nurses giving the Binax test?
I do think it's similar to the concept of pool testing, that we would not be testing students without permission of a parent.
Yeah, we're not just going to give it.
Correct. So it's not like you're at school, you've given permission, they were just going to test a student. So a nurse or administrator would get permission from the parent if they're exhibiting symptoms. If they are negative, then they would go home, and we would start the close contact tracing protocols. If they are negative, we would encourage we'd kind of track that, right? The 10 days, making sure there's no increase of symptoms. The child would be required to wear a mask because, again, they would be in that individual color code system now exhibiting symptoms and monitoring. But then the parent is aware too, and can then make a plan with their PCP regarding other pieces. So just want to make sure that it would be parent permission for every single time we test.
Okay. Jeremy?
Can we expect that, as Jody and Kathy just mentioned, that after the nurse has given the child a cough drop of water and a mask, that the teacher will get a phone call saying that the student needs to wear a mask the rest of the day?
So I think if you send a kid down to the nurse and they're coming back, you can have confidence that the nurse has done their job and knows of the symptoms, and the child is safe to be where they're supposed to be. And if they were unmasked there and are masked there, they would be wearing a mask while they're still exhibiting symptoms. Similar to that, all of a sudden you see a kid that has a really runny nose, maybe didn't have it in the morning, but has a runny nose now. Send them to the nurse, we would check it and probably be wearing a mask while they still have a runny nose for the duration of their runny nose.
I guess my worry would be that a kid goes down to see the nurse, they don't want to wear a mask, they ditch it on the way back, and I'm never told that they were supposed to wear a mask.
Gotcha. Yep. Jody?
I can't imagine high school doing that at all.
No, gosh, no, definitely no. No, or middle school students for that matter. Right, Ben? Jody?
So my process last year was sending email to the team of teachers with just information about this student is out for this many days. They can be expected back on this day. No individual health information, just don't expect a child in your classroom or make a recommendation or make, you know, accommodations so that they can learn from home. So I would do the same with masking at the middle school. I would send an email out to the team saying so-and-so needs to wear a mask until this date.
Okay. Thank you. Anybody else?
So it's kind of a conversation for like admin, right? If a kid is not compliant, this is your opportunity to stay in person by wearing a mask. If you're still exhibiting this and refusing, then you're kind of heading to that red remote learning. But
You're
that would
going to
be
need,
admin level.
Bob?
yes, you're going to need to get permission for each test. You can't go ahead and get parental permission to administer their test should their students be identified as having a possible symptom.
No, it's no different than if we did Tylenol or other things like that. Every time we administer it, we would have to give permission. Pool testing is different, where you do one permission at the beginning of the year, and that counts for pool testing for the whole year. But rapid testing, we would want to, we want to make sure we have a conversation with the parent that they're aware that their child is ill in some regard. And we also want to make sure that that there's communication regarding us giving a test.
All right. So, yeah. All right. I guess as long as we can get a hold of the parents, but we'd have to get a hold of them either to send them home or to let them get permission from the test, one or the other.
Either way, yeah.
Yeah. Or the student sits in a room isolated for the rest of the day and then rides home on our bus.
All right, anybody else? Okay, Jeremy, where do you land with Binax testing?
It's a great help to our community, so yes.
Okay, Kathy?
Yes.
Sherry?
Yes.
Marco?
Yes.
Okay, Bob?
Yes.
Jody?
Yes, please.
Nancy?
Yes.
Lexi?
Yes.
Heather?
Yes.
Jamie?
Yes.
Ben?
Yes, please.
Norma Jean?
Yes.
Brandy?
Yes.
Will?
Yes.
And Glenn?
Yes.
And I am also a yes. I think this will be, if nothing else, a good help. I mean, you figure it's an interesting conversation, right? Because, you know, for instance, with a pop-up clinic and things like that, my wife is a school nurse. She said to me the other day, so is your local pharmacy going to come in and help you out to do a pop-up clinic? And I said, local pharmacy? We don't have a pharmacy in our 3 towns. And so I think this just helps our community even more. So I'm on board as well. All right. We'll make
Thank you to the nurses for exploring this again and thinking of new ways to help our kids stay in person. So applied to the school nurses.
Yep. Thank you very much. All right. Next one on my list is the hot topic of the moment, masks. Let's talk about that. Anybody want to start?
I think I already weighed in on that a while ago. I just would reiterate that I think it's an important piece to have, especially given the fact that we're scaling back some of our other preventative measures.
Okay.
And I think I spoke on it as well. I support universal masking. I don't think that those that are unvaccinated probably come from families that oppose masking. And so to ask them to voluntarily mask might not provide much protection, unfortunately. And in order to protect the students that can't get the vaccination for one reason or another, or may have it but could catch it again, if you still catch it, I think universal masking is our best option.
Jeremy, you have your hand up.
I do. I would, you know, just knowing my own son, he's 14 entering Lewiston High School, and some of the communities and parents as well, although a town over, a lot of the reason they're getting vaccine is so they don't have to wear a mask. And so I wonder, you know, first you're gonna have a good deal of pushback. I think people who have gotten the vaccine and have done what they've been asked to do are going to expect not to have to wear it. And then also, although it's going to be difficult administratively, I think you're going to get probably some more kids to get the vaccine who are eligible if they have to wear a mask otherwise. So I would say anyone who's unvaccinated should have to wear it.
Okay. Brandy.
So I'm going to be the one that's on the other end. I have kiddos that have been in summer school and sports all summer long, and they have had the freedom without a mask. And I think given the low numbers that we're seeing in children, it's important to keep that in mind as well. So I think doing the 6 feet and having, the Binax available, I am not for masks. I think it should be optional. And I think we've kind of proven that what we've done this summer and with the sports has proven to be successful because we haven't not had any cases. That's my opinion. And I have a kiddo that struggled last year who's hard of hearing, and I know masks were huge for her. She reads lips, and so that was something that was a huge deal. And especially for the little ones, I feel like, yes, they're unvaccinated, but again, we're not seeing high numbers. And I think these kiddos need some normalcy and giving them the freedom like this summer, going to school. I think we're gonna have a real struggle come September when we are all of a sudden forcing them to have masks again. That's my opinion.
Will?
Can I just ask a clarifying question? Are we like saying no mask or mask, or are we saying, are we following the plan as it's written or universal masking of that component?
I think what we're doing is, from my perspective, and maybe I'm wrong, we're talking about masks in general right now, but when it really comes down to it, are we going to follow the guidance in the plan, or are we going to go universal mask?
Okay,
That's where I am.
Yeah, and I should verify, I support the plan that Kathy has put forward. And like, I'll be the first to say, my kids go to daycare. Last week they had a cough. They did not go to daycare all week. They had negative COVID tests, and we still did not send them because they don't mask there, and I didn't want to spread it. And I know some people are obviously worried, and not all parents like that. But I do support your plan as to like the color codes and when we think a child should. I'm not saying across the board, no, but I don't think we should mandate it across the board that yes, they need to go to school every day with a mask.
Yeah, and it wasn't necessarily to you, Brandy, but I was just making sure when we're like voting one way or the other, are we like to plan or universal masking? I just want to make sure I was clear about how to move forward. So thank you.
Thank you, Kathy, because that clarifies it. Will, you had your hand up?
Yeah, that clarified it for me. I was going to ask the similar as to where we were, and I support Kathy's plan, the information presented earlier.
Okay. Anybody else want to talk briefly? No? All right. I can tell you where I land before we start this. I am not in favor of universal masking. I think Kathy's plan as written helps us to not have to be there. I think a lot of work and thought went into that. I know what the surrounding communities are doing. I also know what I will do with my own children. And so, consequently, I think, from my perspective, I believe this at this point in time, and actually, my wife and I had the same conversation the other night. I believe we should follow the CDC recommendations, that it is a recommendation. And then we have a mitigation strategy there, but that I am one opinion. So, Brandy, did you want to speak again? No? Okay, let's put this out there. So here we are. Are we following the plan as written, or are we universal masking? Brandy?
I support the plan.
Okay, Kathy?
Plan.
Jeremy?
I need another minute first.
Okay, all right, Sherry?
I support Kathy's plan.
Okay, Marco?
Universal masking.
Okay, Bob?
Universal masking.
Okay, Jody?
I support the plan.
Okay, Nancy?
This is a hard one. The reason it's a hard one for me, I think mostly is that we're talking about the variant, and I don't think we know anything about the variant. And I understand that that young kids haven't been affected so far with what we've been doing, but I just think we don't know what's around the corner with this. I think it's going to be really hard to enforce outside of a teacher's classroom the kids who, and to know the kids who are supposed to be wearing a mask and who are not. I just don't know how anybody would sort that out in a lunchroom or in a UA class. I don't know how anybody would know which kids are supposed to be wearing their mask, even though they ditched it at the door. That all concerns me. It concerns me about kids with cognitive challenges having to go back to wearing a mask. They've learned how to wear a mask and now they're watching kids around them not wearing a mask. So I just think it's going to be really tricky. I think I want to support Kathy's plan with the idea that if things started to go up, we would revisit it and probably quickly go back to universal masking. I would not want to wait on that.
Okay. All right. Thank you. Lexi?
I support the plan.
Okay. Thank you. Heather?
I agree a lot with what Nancy just articulated, and I agree with the plan, but I think that, you know, if we need to, we make that decision sooner rather than later, moving forward about universal masking.
And the reality is there may come a time where it changes and it's mandated and we come back and discuss that. So Jamie?
I think Nancy was reading my mind. So I do have reservations, but I think that we're so ready to try to start getting back to where we used to be that I think the plan is a good place to start, as long as we can step on the brake fast if need be.
Okay, thank you. Ben?
I think we've proven ourselves to be pretty flexible the last 2 years. I'm all about the plan.
Okay.
Just knowing though that when it's time that we can put the masks on.
Yep, I agree. Norma Jean?
I support having a kids in for as long as possible. So I guess I support the mask.
Okay. Will?
The plan as is.
Oh, I think, yeah, that's right. You weren't up at the top of my screen. Somewhere you moved. Glenn?
Universal masking.
Okay. So there are 16 of us. And I am in support of the plan as well. I agree with what I think we need to be nimble. We've proven that we can be nimble. And if things start to kind of look like they're blossoming, we come back to this group and we make a new recommendation.
I don't think you got Jeremy's vote. I think.
Oh, Jeremy. Yes, I need to go back to Jeremy. Sorry.
Oh, no worries. So, and if I, just let me start with this, I guess, right? If I'm reading the plan again, my notes for the plan anyways, 2 to 3 cases within 10 days in a school triggers a yellow, yes? So we have a pretty quick yellow anyways, and yellows are all masking.
Yeah, correct. So if you have increased, it would be a universal masking in yellow.
Yeah. So I guess I'd go with the plan then.
Okay, thank you. All right, so 16 of us, it's a 12-4 vote. So the recommendation of this team is the plan, but we also need to share with the board that it wasn't a unanimous decision. I think that's really important. And this team is recommending that. It was not unanimous, and I will make sure the board knows that because I think that's important. I mean, Bob will too, he's here, but I think that's important, and then the board will make a decision. So what else? It's 10:50. We had said 9 to 11. What else do we need to do? Anybody else have thoughts? Jamie?
This is a little different than the majority of the stuff we've been discussing today, but I just got an email 2 seconds ago that reminded me, building usage. I know at one point we were kind of like, let's go back to normal, but building usage and field trips are 2 things that are big time on the radar right now. Lots of questions.
Yeah. And it's funny because I said this to Kathy this morning and it just left my brain. So let's talk field trips first. Where are we still on field trips?
So I do want to just remind you that they did give some updates on field trips in the standard operating procedure or in the the guidance before that they are allowing field trips. They do recommend that if you can stay within your county, that would be better. If it can be outdoors, it's better. If you, in looking at, you should not be going on field trips that are in counties that are red and have high transmission. So I know that makes it really challenging when we're trying to plan field trips that are months out, or, you know, and this is kind of like a weekly change. But it's really, I think it's going to be one of those things that we're just going to have to be mindful, and maybe have a conversation like about specific field trips, about what's allowed or not allowed or that kind of thing. But it's a yes, usually in your county, if we're not in the red, and also a no if it's like in high transmission areas. But field trips are a yes. And, you know, similar, so I would just start with field trips, I guess.
Okay. Anybody else want to say anything about field trips?
It's a big part of our FLS programming. There's a lot of learning that happens with some of our kids on these field trips, and they've been direly missed the last year and a half. It'd be good to get some of that back.
Okay. Anybody else?
I guess my concern about field trips is that, you know, there's a lot of recommendations out there about inside wearing masks, even if it's not in the school environment. They're recommending that in a lot of places, and of course, on the transportation on the field trip will require masks.
Mm-hmm.
So, you know, we just need to be cautious on where we're going to take the students, and to be able to plan where we're going to go 2 months from now, I think is probably an exercise in frustration. So, you know, be cautious. Is it really required for the educational experience, or can that be provided by some other method? And just, you know, I am concerned about where we're going to go, because now there's another variant that's coming up that they haven't tested against all the vaccines and everything. So this is going to be a long haul. And I would just prefer that we take every step we can, so we don't have to have the sacrificial lamb before we react.
So would it make sense that the administrative team came up with a field trip SOP and brought it back to this team, to kind of make sure that we're following the guidelines, and we're clear about if it's field trips, maybe everyone has to do universal masking if we're going to different places or what have you. So I don't know what the parameters would be, but just making kind of what the SOP and then bringing it back versus a yay or nay. And again, I think there will be new guidance coming back before vacation ends, summer vacation ends. So I guess that would be my recommendation, is let the administrative team come up with an SOP to bring back to this team. So it's not a hard no, but it's a yes, but you have to follow this SOP.
I can be on board with that.
Yeah, me too. And use of facilities real quick. I can't see why, since it's been kind of somewhat proven that it's not because of people using facilities, it's really respiratory. And just because some kids were in the gym tonight, they're certainly not in a 6-foot circle tomorrow morning. So I don't know how we should eliminate the use of our facilities from our community members anymore.
I agree, Bob. And so the update too, were also like volunteers and things, so limited. Obviously, you know, we're going to have conversations regarding they still have to follow our SOPs and such, but so volunteers and people being in our buildings is safe now in terms of CDC recommendations. So.
And I agree with you, Bob. I think a lot of you that know me well know that I want our buildings used by the community as much as possible. And it has really hurt my heart to some degree to have had to say no to some things that I think would have been really good for kids. I don't want to say no to those things anymore right at the moment. I think, like Bob said, you know, what the CDC is saying, that we know we're not going to catch COVID from a surface. And I'll be quite candid, you know, our cleaning practices in RSU 4 at Glenn has done a fabulous job. Glenn and his crew, I walk into other school buildings, our buildings are fantastic. The cleaning practices that we have in place are fantastic. So regardless, I have no qualms. Does anybody else?
I want to say one other thing though, real quick, is that it's not just students and youth that use the building. There's a lot of community activity go in there. I would hope that when I used to do the voluntary tax preparation, all right, for people for tax aid in the high school, I would meet with people in today's world when they come in and I'm doing something like that, whatever it might be a knitting class or whatever. There should be some information with whoever's coordinating that activity, that should they find out that a member that attended came down with COVID, that the other people, we have a means to contact those others that were in close proximity.
Mhm.
So it's not you know, I only had one client at a time or a couple at a time doing taxes because we were doing it in a group, right? But on some of these other life enrichment courses that we offer, we have to make sure that we are protecting all those who attend and maybe they're not used to signing in and giving contact, but we have to have some way to get a hold of them if we find out that someone came down with COVID.
Well, and I think too, you know, beyond that, I mean, I look at like the Litchfield Senior Center has used our buildings before. I want to go back to that. Like I want those things to start happening again. So, and I agree with you, Bob. As far as our enrichment courses are concerned, everybody has to sign up for those. So we do have contact information, but I would also want to share with our outside groups, you know, please be prepared to have contact information in case you have a case. I think that's important. Sherry?
As a PTA member and a Girl Scout leader that have used the buildings in the past, you know, we have set guidelines for Girl Scouts. So all the girls would be masked. I mean, we clean our areas after we're done using them. As a PTA member, we would do the same thing. So, I mean, you know, we're definitely interested in, you know, being able to use the school buildings again so that we can get back to what we were doing before and helping out the community. So
Yeah, I agree with you. It's super important. So.
Yeah.
So does it make sense to have a contract or an SOP that would go with the application? Like you're agreeing to these other, it's not just a request for building usage, but maybe like in terms of a COVID SOP, you contact the school to let them know if you've done contact tracing or what have you.
absolutely. Yes.
Yeah,
Just
we
add something to
certainly create something like that to attach to the building use form.
Yes,
sure.
because I think the thing is the last year and a half of school, we've had to do Zoom meetings and as a Girl Scout leader, we've lost a few girls because they just do not want to do the Zoom. They all want to be together. And as a PTA member, we've lost a lot of people that way too. There's 5 of us currently right now that are on the PTA, and we've been the only ones, you know, keeping it going. And we like to be able to raise funds and help out the schools and continue what we're doing. But I think that when we can't meet in person, it just, you know, everybody just kind of drops out and they don't want to do it. So.
Yeah, I agree. And it's same thing with the boosters. You know,
Yes.
the boosters being able to meet in our buildings is key. I know that their participation has been down as well. So.
Yeah.
All right, we can develop an SOP. I'm hearing it's pretty unanimous in that regard. Will, did you want to say something?
No, that's perfect. I think a similar SOP to what we're talking about, just so that there's clarification. I think we need to get people back in the buildings.
Okay. All right. Thank you all. Anything else?
Do you have an idea of a next meeting date?
I do not at this point, but I think do we need to set when we need to do? They need the administrative team to develop an SOP. When are we meeting next, Kathy? I can't remember off the top of my head.
Well, we were going to wait to see what this school board meeting was going to be like on August 11th. And then we were also waiting for the updated SOP and symptoms. So I don't really want to set a meeting until we know when that comes out. MPA doesn't meet till the 18th. So we're really talking the week of August 23rd through the 27th, if there would be any changes before school. So I wouldn't
I know that seems far out, but there's going to be a lot of things that come out in the next week and a half.
Yep. I think at this point, setting a next meeting, I will be in touch as I have been about a next meeting, but you can, we need to have another one once those things come out. So.
Sure. Thank you.
Awesome. Just again, thank you all for your time. We ran over, but I think the conversation that we had today was very fruitful. And I appreciate the thoughtfulness in which you all approach this work, because it is important for sure. So thank you. Enjoy the rest of your Monday.
Enjoy. Stay
Awesome.
cool.
Thank you, guys.
Thank you.
Thank you.
You.